Hi, my name is Yvonne. Today I'll be talking about Breo Ellipta. The generic name is fluticasone, furoate, and vilanterol. The topics to be discussed in this presentation includes medication indication, common side effects, patient education, background information, and lastly, warning and precautions when using this medication. First, what can Breo Ellipta be used for? Breo Ellipta 125 is indicated for the long-term maintenance treatment of airflow obstruction in patients with COPD. It's also indicated for the treatment of asthma in patients aged 18 years and older. What are the most common side effects of Breo Ellipta? These include headache, back pain, joint pain, fever, flu symptoms, increased blood pressure, runny or stuffy nose, sore throat, cough, and hoarse voice. Let's move on to discuss the most important counseling points to the patient. We will begin with teaching the patient how to use Breo Ellipta. Step 1. Slide the cover until hearing a click sound. Once you hear the click, you should see the counter on the front of the inhaler count down by 1. This shows how many doses you have left in the inhaler. Avoid sliding the cover open and shut without using the inhaler. Step 2. Exhale before bringing the mouthpiece to the mouth. Hold the Breo Ellipta inhaler away from your face while you exhale. Then bring the inhaler up to your mouth so the mouthpiece is between your lips. Avoid blocking the mouthpiece with your teeth or tongue. Step 3. Keep the mouthpiece between your lips and take a long, steady breath. Do not breathe through your nose or you won't get the dose of the medication. Make sure you do not block the air vent with your finger. Step 4. Remove the inhaler and hold the breath for 3 to 4 seconds. Release your breath slowly. If your doctor has prescribed more than 1 dose of Breo Ellipta, wait 30 seconds before inhaling the second dose. Step 5. Slide the cover over the mouthpiece and place the inhaler in a dry place away from heat and light. Throw away the inhaler once the counter on the front shows 0 or the inhaler has been open for 6 weeks. It is important to rinse mouth immediately after using the inhaler to avoid oral thrush. What are the important points to teach patients? Breo Ellipta should be used at the same time every day and do not use more than 1 time every 24 hours. If the patient missed a dose, he or she should be instructed to use the missed dose as soon as possible, but skip the dose if it's almost the time for the next scheduled dose. Do not double dose to make up the missed dose. When should the patient contact his or her physician? The patient should call the doctor for preventative treatment if the patient is exposed to chickenpox or measles, or if the patient experiences the following symptoms: wheezing, choking, or other breathing problems after using this medication, chest pain, fast or pounding heartbeats, sore or white patches on the mouth and throat, blurred vision, tunnel vision, eye pain, or when the patient develops signs and symptoms of high blood sugar. Moving on to the background information about Breo Ellipta. Mechanism of action. Fluticasone is a corticosteroid that activates glucocorticoid receptors, inhibiting the NF-kappa B and the lung eosinophilia, resulting in anti-inflammatory activity, immunosuppressive properties, and anti-proliferating actions. Vilanterol is a long-acting beta-2 agonist. It relaxes the bronchial smooth muscles by selectively acting on the beta-2 receptors, with very little effect on the heart rate. How does the body process its medication? During the absorption phase, inhaled fluticasone has 13.9% bioavailability and 27.3% bioavailability for vilanterol. Fluticasone has more than 99% plasma binding ability, and vilanterol has about 93.9% plasma binding ability during the distribution phase. Both fluticasone and vilanterol are metabolized by the hepatic enzyme CYP3A4. Lastly, the half-life of fluticasone is about 24 hours and 21.3 hours for vilanterol. How to dose Breo Ellipta per condition indicated. For COPD, Breo Ellipta 125 should be administered as one inhalation once daily. The maximum recommended dose is one inhalation of 125 strength once daily. For asthma, the recommended strength of Breo Ellipta could be either 125 or Breo Ellipta 225. Both should be administered as one inhalation once daily. The maximum dose for asthma is one inhalation of Breo Ellipta 225 once daily. Now let's discuss which drugs can interact with Breo and should be used with caution. First, CYP3A4 inhibitors. Co-administrations of Breo and CYP3A4 inhibitors will increase the systemic corticosteroid and increase the cardiovascular adverse effects. Concurrent use of Breo and certain antipsychotic drugs belongs to the class of MOAI and TCA will increase the risk of ventricular arrhythmia due to prolonged QT intervals. Non-selective beta blockers may produce severe bronchospasm in patients with COPD and asthma, though they should be used with caution. Non-potassium sparing diuretics such as loop or thiazide diuretic administered with Breo may result in hypokalemia in patients. This medication should be used only if the benefits outweigh the risk. What are the most important warning and precautions when using Breo? Candida albicans infections. Development of localized infections of the mouth and pharynx with Candida albicans has occurred in patients treated with Breo. To minimize the risk of the infection, patient needs to rinse their mouth immediately after using the inhaler. Increased risk of pneumonia in COPD patients. An increase in the incidence of pneumonia has been observed in patients with COPD receiving Breo in clinical trials. Physicians are advised to remain vigilant for the possible development of pneumonia in patients with COPD, as the clinical features in such infections are very similar to COPD exacerbations. Immunosuppressions. Long-term use of corticosteroids may suppress the immune system and result in increased susceptibility to infections. Chickenpox and measles can have more serious or even fatal course in susceptible children or adults using corticosteroids. Hypercorticism and adrenal suppressions. Using Breo more than recommended dose or co-administration with a potent CYP3A4 inhibitor may result in HPA dysfunctions. Patients should be monitored closely. Reduction in bone mineral density. Decreases in bone mineral density have been observed in long-term use of inhaled corticosteroid. Patients with major risk factors for decreased bone mineral contents, such as prolonged immobilizations, family history of osteoporosis, postmenopausal patients, tobacco use, advanced age, or chronic use of corticosteroid should be monitored closely for risk of fractures. Glaucoma and cataract has been reported in patients with COPD or asthma following a long-term administration of corticosteroid use. Patients should be referred to an ophthalmologist if they develop ocular symptoms. And thank you. That concludes today's presentation.